Eugenics is a pseudo-science that resulted in 60,000 men and women being forcibly sterilized in the United States during the 20th century. Using the United States as a model, Adolf Hitler employed eugenics to forcibly sterilize 400,000 men and women during the Holocaust. In the United States, black women were the principal target of forced sterilization. In Nazi Germany, Jews were the principal target of forced sterilization. In their quest for a perfect society, eugenicists labeled racial and ethnic groups as fit and unfit. Eugenics aimed to eradicate blacks in the United States and Jews in Nazi Germany. The United Nations describes forced sterilization as genocide. Again, Nazi Germany followed in the footsteps of the United States. "There is today one state," wrote Hitler, "in which at least weak beginnings toward a better conception of citizenship are noticeable." Of course, it is not our model German Republic, but the United States. The foundation of eugenics was laid in the early 1800s. Thomas Jefferson is known for the famous words in the Declaration of Independence, "All men are created equal." Jefferson was also a slave owner and owned over 600 slaves during his lifetime. Jefferson fathered 6 children with a slave named Sally Hemings. In Notes on the State of Virginia, Jefferson described his slaves at Monticello as lacking beauty, emitting a very strong and disagreeable odor, were in reason inferior, in imagination were dull, tasteless, and anomalous, participated more in sensual activity than reflection, never conversed in thought above the level of plain narrative, and were never seen producing even an elementary trait of painting or sculpture. Eugenics began in the late 19th century in England. Francis Galton, an English statistician, demographer, and ethnologist, coined the term eugenics in 1883. In 1869, Galton published Hereditary Genius, in which he described eugenics as the science of improving stock. Galton claimed that health and disease, as well as social and intellectual characteristics, were based upon heredity and the concept of race. He called for the British government to encourage those of high rank to marry and reproduce by providing financial incentives. In the 20th century, Galton's ideas were adopted in the United States as justification for forced sterilization of blacks and other disadvantaged groups. In the early 1900s, the University of Virginia, which was founded by Thomas Jefferson, was at the center of the eugenics movement in the United States. Virginia eugenicists advanced the idea of involuntary sterilization as a means of restricting the population of blacks, poor whites, and the mentally defective. Eugenics began to shape public policy nationally as early as 1907. Indiana passed the world's first sterilization law in 1907. 31 states followed suit. In the 1920s, many states authorized the forced sterilization of people with disabilities, prisoners, and racial minorities. 2 Virginia eugenics laws, both passed in 1924, had a profound impact in the Commonwealth and throughout the country. The Virginia Sterilization Act and the Racial Integrity Act not only legalized forced sterilization of the mentally ill and persons of low literacy, but also targeted African Americans. The Racial Integrity Act of 1924 was designed to stop the intermixture of white and black people. The act banned interracial marriage by requiring marriage applicants to identify their race as white, colored, or mixed. The law defined a white person as one with no trace of the blood of another race. As Virginia's first state registrar of vital statistics, Dr. Walter Plecker was the driving force behind the law and oversaw its enforcement. He declared that intermarriage of the white race with mixed stock must be made impossible. He meticulously checked each birth certificate and marriage license in the state and wrote frequent letters to county clerks who failed to uphold the law to his standards. In 1927, in Buck v. Bell, the U.S. Supreme Court upheld Virginia's forced sterilization law. This court case set a precedent for the legality of eugenic sterilization efforts in the United States. The court held that it is better for all the world if society can prevent those who are manifestly unfit from continuing their kind. In the infamous concluding words of Justice Oliver Wendell Holmes, 3 generations of imbeciles is enough. The case won wider acceptance for eugenics, and the number of sterilizations increased dramatically throughout the U.S. into the 1930s and beyond. White elites with strong biases about who was fit and unfit embraced eugenics, believing American society would be improved by increased breeding of Anglo-Saxons and Nordics, whom they assumed had high IQs. Anyone who did not fit this mold of racial perfection, which included most immigrants, blacks, indigenous people, poor whites, and people with disabilities, became targets of eugenics programs. In North Carolina, which sterilized the third highest number of people in the United States, 7,600 people from 1929 to 1973, women vastly outnumbered men, and black women were disproportionately sterilized. Preliminary analysis shows that from 1950 to 1966, black women were sterilized at more than 3 times the rate of white women and more than 12 times the rate of white men. Out of all of the patients involuntarily sterilized in North Carolina, African American women made up from 23% between 1930 and 1950 to 59% between 1958 and 1960. And then 64% between 1964 and 1966. The justification for involuntary sterilization became family size and dependency on the government. Poor and minority women were characterized as hyper-breeders who were draining public resources. In 1970, Congress passed the Family Planning, Services and Population Research Act. The act allocated $383 million for contraceptive programs that included grants to hospital for voluntary sterilization in order to reduce the welfare rolls. However, these public funds were used to perform sterilizations on minority women who did not understand the procedures they were undergoing. Most of the physicians performing these sterilizations were white men who believed they were helping society by limiting the number of births in low-income and minority families. Fewer births would reduce society's tax burden. Physicians also earn more by performing sterilizations as opposed to recommending non-surgical alternatives. Civil rights activist Fannie Lou Hamer coined the term Mississippi appendectomy to raise awareness about the experience of women who, like her, went to the hospital for treatment and were sterilized without their consent. A 1968 study found that over 1/3 of the sterilized women did not fully understand that tubal ligation tying the tubes was permanent. Many of these women believed that the procedure was reversible and were not informed otherwise by medical professionals. In 2012, North Carolina became one of a handful of states to acknowledge this shameful history when it formally apologized and offered compensation to surviving victims of its 40-year sterilization program, 4 decades after its end.